My name is Beatrice Chimpi. I want to welcome you back, all my viewers, to this YouTube channel. I hope you've had a nice week. And today we are joined by a wonderful person. He is a doctor, he's a lecturer, he's a father, he is a husband, and he is going to be taking us through dental oral hygiene. Good morning, doctor.
Good morning.
You are most welcome.
Thank you.
Introduce yourself.
Okay, my name is Dr. Odor Paul. I'm a dental surgeon, and I practice dentistry for quite some time now. And I work with the Jinja Regional Referral in dental department.
Nice having you, sir. We are glad to have you on this show.
Thank you.
And many people have been waiting for a long time for a consult from you, and I believe they are going to be blessed. And one of the major issues that we have, the viewers have of this channel, has been dental odor. Some people are concerned that even if they brushed, still their teeth remain smelling, or their mouths remain smelling. What could be some of the causes of dental odor?
Okay, thank you very much. It's a good question, and it's one of the pertinent issues asked by the common person or the community. And it is also, I must say, maybe in 10 people, at least 1 or 2 might be experiencing a dental odor. In the dental fraternity, we call it dental halitosis, literally meaning bad breath. And there are so many factors that may be causing it. There are other local factors and there are other systemic factors. When I talk about local factors, these are the things that can easily be preventable. Like, for instance, your oral hygiene. Oral hygiene, I mean how you keep your mouth clean, because bad breath can easily come when your mouth is not well brushed. It can also come because of the type of food you eat. It can also come because of certain diseases that are in our blood. Those can also be contributing factors to bad breath. So basically, that's what I can say. But mostly the key one is dental related. When I say dental related, the hygiene or the care you give to your mouth. If you don't take care of your mouth properly, you definitely, in one way or the other, get bad breath.
Okay, there is also a word that has been on the street that the kind of food you eat can also lead to the way your mouth smells, something of the sort.
Yes, there are certain foods that may bring bad breath in people. Like, for instance, there are spiced foods you eat. Even taking alcohol in sometimes, when for those who take alcohol, I don't condemn it, I don't victimize it, but when you take alcohol and you don't brush your teeth, you'll definitely get bad breath. Mostly when you take spiced food, garlic and so on. In a long run, you'll definitely have what? Bad breath. But the key thing is, like, for instance, when you have holes in your mouth, the holes will retain some foods, and those foods, a mouth is a unique part of our body. It has some germs, we call them microorganisms, multiples of germs, and those germs in the mouth, they feed, and when they feed, any living thing, when it feeds, you'll always excrete, you give a byproduct, and the byproducts of those germs, they contain a certain acid that will corrode the teeth, and when the holes are in the teeth, so the food will pack there. Imagine you have eaten maybe matoke, and it is kept in that hole for, let's say, 2 weeks without it coming out. It will definitely give you bad breath. So certain foods and also the holes in our mouth will definitely bring bad breath. It is a normal, a big trend of a problem in the community that needs to be addressed, and that bad breath can be addressed. It can be solved.
But there's a way your gut is connected to your mouth, that sometimes the bad smell could be coming directly from your mouth, from your stomach or intestines to your mouth.
Yes, that's why I said earlier on, there are certain conditions that are systemic. They come from our body. Like for instance, if you're maybe when you belch, in most cases when you belch, when you have probably some ulceration in your stomach, when you have liver disease, when you have certain conditions. That's why bad breath can be treated by a dentist, which is associated with the mouth. But that which is in relation to the problems in the blood and so on, you will definitely, it is a combined kind of treatment. You refer a patient to a physician if he or she has liver problem, if he or she has maybe an ulcers and you belch. So in most cases it can come. That is true from the stomach.
So we've looked at some of the causes of bad odor or halitosis of the mouth. And then our major question that everyone is waiting for, how do we, you said it's curable, how then do we deal with this thing?
Okay. Now, if it is the one which is caused by the poor oral hygiene, I mean neglected taking care of your mouth, whereby someone can brush maybe twice in 3 days and so on and so forth. So the key thing is, one, you must visit a dentist. You must visit a dental professional for this bad breath to be diagnosed. To be diagnosed means to know the cause. And you cannot only know it if you have just not gone to the dentist. So as dentists, they will know the root cause, they will go, they will have an interaction with you, then they will know the root cause of the problem. Now when the root cause of the problem is known, then he has an experience in his training to execute what will solve the problem of bad breath. Number one, if it is related to dental, if it is of dental origin within your mouth, we can always do what we call professional cleaning and polishing. We have machines like this chair. You clean the mouth, because this bad breath can come because of some coating. We call it caliculus. And that coating will create space in the gum. The gum, which is, the gum is supposed to tie a tooth like a collar-like when somebody puts on a necktie, so that it avoids germs to harbor in that area. So what we do as dentists, we examine and see, is the gum in health? If the gum is not in health, in most cases, people who have bad breath, they have inflamed gum. Inflamed gum means they have gums disease. The gums are swollen, gums can easily bleed, and so on and so forth. So what we do, we clean around the gum, because there is some caliculus. The common people, they call it kaboli. Is it kaboli in Uganda? And they think it is a genetical, but it is just because of the care you neglected your mouth. So what we do, we clean the mouth properly, and when we have cleaned the mouth, we can even give you some mouthwashes. And whenever the mouth is clean, whenever the gum is taken care of, the body has the ability to regenerate, and the gum will stick there properly, closer to the teeth, and will not allow microorganisms to harbor there to cause a gum disease. And that will cause elimination of what? A bad breath. Then also another thing we do, we fill all the holes. We call them cavities in dentistry. All the holes in the mouth, we fill them with there are some cements. When we say cements, we are not meaning the cement you use for building. There are some cement we put there, and when we have filled all that area, we get very good results with gum. Then also the tongue. The tongue has got coating, and mostly behind part of the tongue, people don't clean. That is an inhibitor or a niche for micro or germs that will cause bad breath. Mostly when someone talks, the breath, bad breath comes out. So we also professionally clean your tongue and also take you through all the steps of what? Cleaning the tongue. We take you through all the steps of ideal toothbrushing and when you should brush and how properly you should brush, and that will clear any bad breath that is caused by within the mouth. But now, if it is breath that is caused by other diseases that are in the blood, we refer you first to the physician of that specialty. Then when he has given his treatment, we do a review with you to make sure that you get help. Yes.
Wow, thank you so much. So you've touched something very, very important. One of the things that lay people do not know is the technique of cleaning their mouth at home by themselves, the teeth and the tongue. Could you take us briefly in those steps?
Okay. I can say why we have a lot of gum diseases or bad breath or diseases of the mouth, we don't pay much attention in cleaning our teeth, because in most cases some people brush when they have already dressed. For ladies, when they have done their makeup, they spend more time in makeup than brushing. They can even spend 30 minutes doing the makeup, but in brushing they take less than 20 seconds and they are out of the brushing area.
Yes.
And that is very bad. And yet the mouth is a place. It is first of all a dark place, and it has a lot of germs, and that's why when you just keep quiet like this and then you begin speaking, there will be bad breath, because the germs are living and they are what? They are active. So one, in books they say you must brush after every meal. Ideally it is very difficult because we eat very often. You brush after every meal, but I would recommend that in the morning when you have woken up and you have had your breakfast, it is always very important that you brush. You leave home when you have gone to work, when you have brushed your teeth, because that period from taking breakfast and going to work, the acidity in the mouth will be lowered to the level of becoming what? Acidic. Because the microorganisms are very active. So now our teeth will be affected by acid. So that's why we always brush. And when you're brushing, you need to use toothpaste, of course. I grew up in the village. I could brush using sand with the traditional toothbrush. We could even use charcoal, thinking we want our teeth to be very white, which could be a mist in one way or the other. But ideal brushing is the frequency, mostly morning after breakfast, then evening after you have had your supper. Before going to bed, you need to brush in an ideal way. How we brush, but always we need to use a soft toothbrush, and that soft toothbrush, you use circular motions. You need to use circular motion, not the aggressive way of brushing that we always use, because when you do aggressively, the gum, I can say it is one of the romantic parts of the body. When you handle it aggressively, it will not be happy. That one will bring in other diseases in the mouth. One of them is gingival recession. The gum goes inwardly, and when it gets inwardly, it will expose other parts of the teeth, and that brings in bad brushing, will bring in generalized sensitivity in the mouth. But ideally, I know people want hard toothbrushes. Those ones don't, they may not be cleaning very well. And being so tough to your teeth is not the way to brush. The very way, I'm sorry to use ladies as an example, the very way ladies are very kind to their face when they are doing their makeup, so must you also be very kind when you are doing your toothbrushing. But ideally, you must use toothpaste that has got fluoride content in it, because fluoride makes the tooth resistant to tooth decay. There is what we call hydroxyapatite. The microorganisms cannot easily break the tooth down to create what? To create hole and bring other diseases of the mouth or the oral cavity. So brushing is very key. And this is God-given. You brush, you'll have less visits to the dentist. But if you don't brush, you get oral diseases or the diseases of the mouth. Dentistry is quite expensive. You'll definitely have to spend if you don't brush. So ladies and gentlemen and all the viewers, just brush morning, evening. After when you have had your lunch, rinse your mouth with at least water, not soda, because anyway, we shall get to that later. Thank you.
So, doctor, for most of the people, I use that people brush down and up, down and up. So what's the best technique for brushing, like you said, circular?
Okay. There are different techniques of brushing. Even the one people are using, it's one of the types of brushing. But it is used in a wrong way. That is the only thing. I don't condemn anybody who has been brushed. The technique you're using is okay. There are several techniques, but only you have been using it in a wrong way. Like these ones of this kind of brushing, that is okay. That is one of the techniques. But we say when you're brushing outside surfaces of the teeth, we go circular motion. You're like drawing cycles through it. And you're supposed to do like 10 times on one tooth. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4. You move on each tooth, that circular motion. Why? You'll be sweeping off food debris that have entered on the ideal opening of the gum. You'll be sweeping it off when you do that sweeping motion of what? Brushing. So that's what you do. Then when someone opens the mouth, that's when you use the techniques you're saying, you lift it out. You'll be sweeping them out, sweeping the food debris. By the way, what you are removing from your teeth, it is not something hard. It's just food coatings. It's like when you have eaten maybe, let's say, cakes and there is some particles in your mouth. You just remove with the serviettes and so on. So even these food particles, you just need to use a simple circular motion, and you take some time and sweep of the outside surfaces of the teeth. Now when you open your mouth, now the inward part is when you tend to, you do now that kind of lifting of the teeth, and even the inside part, you do the lifting of that. Even here, just sweeping motion, sweeping motion. Now when you have opened your mouth, in the middle of the teeth where you have, there is what we call depressions. In dentists, we call the pits and fissures. Those depressions there is now when you put in that vertical kind of tooth brushing, where you move back, force, back, force, back, force. We call it straight motion, or on the occlusal surfaces. Occlusal means is at that level when you're cleaning back, forth, back. So you see now I've used like 3 techniques when you are doing. So, but in most cases, we all use that back force movement only, and that will affect this romantic part of the gum. It will recede. If you do that for like 5 or plus years, you'll always be visiting us with generalized what? Sensitivity. And this is a very expensive treatment. You will definitely have to do what? To part with your savings, because you cannot do any work when you have what? Toothache or tooth problem, because the teeth are just connected next to the brain, and you can even run mad when you're having a toothache. So that's why you need to have proper toothbrushing. The same things to the upper and the lower jaw. So if you can spend like, let's say 1 minute, 40 seconds to 1 minute on one tooth, then you must spend more than 30 minutes brushing, not 2 minutes. In most cases, we dress up and do 1, 2, 3, you rinse your mouth, you go. You'll have bad breath, and only the front teeth, the smiling teeth, will be looking white, but the behind teeth have very big problems. So I'm very happy for this interview. I pray whoever is watching and gets an opportunity to watch, forward to others, and make sure you brush in an ideal way. Thank you very much.
Thank you so much, Doctor. That has been so informative. I hope you've learned how that the right technique for brushing your teeth, so that you can avoid bad mouth odor. And doctor, the remaining part of the mouth that people do not know how to wash, that someone opens their mouth and you just see a dirty tongue. How should someone care for their tongue?
Okay, thank you very much. Before I answer that question, if you do all those techniques of brushing, there is another part that you must always do. It might be quite expensive, that your toothbrush cannot easily brush. That one in the middle of the teeth. In dentists we say interproximal spaces, areas where teeth come to unite each other. Yes. There is no toothbrush that can go there. Yes. And if you want to know that your mouth is very dirty, you get a toothpick and you put there, then you smell. It smells more than the natural smell you think about. Therefore, it means you have bad breath or a bad mouth which is not well taken care of. There is what we call, there is a thread-like, we call them dental floss. It is the only thing that we can use for cleaning in the middle of the teeth. And ideally, you must always floss every night after you have had your supper. Nowadays, they have modernized floss. They even have a coating of fluoride in it, because most of tooth decay starts from the depressions of the teeth and in the middle of the teeth. And there, the enamel, which has like we call it calcium, a bone content, it is always at the interproximal. There is how the tooth is, it might be not so big there. So that's why decay always starts around that area. And also the roots unites with the part of the tooth that we see, we call it a crown. So there is a depression there. In most cases, decay starts from there because we don't clean that place. So we have dental floss. They are all over supermarkets around. There are even those that have like a toothpick at the side, then the floss in front. So you need to be cleaning your teeth for you to fully say you have done your what? Your toothbrushing. Personally, I do that at least once, in a day. Moreover, when I'm going to bed. Now, to come to your question of cleaning the what? The tongue. The tongue is one of the unique parts in the oral cavity or in the mouth. One, it has some sensors. It is in the tongue. You know, this is sweet. This is bitter. This is it is tasteless. So the tongue has got several components in it that are delicate, that you need to be always taken care of. And the anatomy, the look, how God created it, makes it very sophisticated. And several people have different types of tongue. There are people, by the way, we have tongues that even resemble the ones of dogs and so on, because there is what we call a geographical tongue, there is a fissured tongue, there is other kinds of tongue. So mostly friends who have like a fissured or geographical, when I say fissured, is tongue with depressions. The tongue can have a deep depression and so on the other side. Then of course a geographical tongue, a tongue can have a very big mouth and some raised portions and so on and so forth. So before I answer your question, one of the reasons that makes people not to clean their tongue very well is because some of them are very sensitive. When you touch the mouth, you feel like throwing away. There is that feelings. Even when we're working, sometimes the patients, you just try to open the mouth, you touch the tongue, it feels like throwing. So, and there are some people, the tongue reacts to certain foods, and the tongue can easily bleed and so on. Those are some of the causes that prevent people from what? Cleaning their tongue. But in the market, there are other tongue cleaning gadgets we have. Modern toothbrushes come with the tongue cleaners where you can just clean your tongue easily. But you can even use your toothbrush. Still, you will do the circular emotion. There is the front part of the tongue, but the worst which is not touched is the behind part, the posterior part of the tongue. People don't, because sometimes when you touch there, you feel like it's throwing. So if you have that kind of thing, you use minimal time. You use lower the number of times you are there if you're cleaning. If you feel you do like 3 seconds, you then clean just for 1 second for a longer period. But you need to do circular movement, not being tough. You'll injure your tongue, and you'll cause ulcerations on the tongue, and you'll cause some pain, and you'll definitely abandon it. But toothbrushing is not complete if you have not cleaned your tongue. And that, if you don't clean your tongue, even if your teeth are very nice looking, you'll have bad breath. You'll have bad breath, and bad breath has even led to problems in marriages, because there's a time at night, maybe dawn, when you're as married, you come closer and discuss certain things on the bed. But when you're discussing and the man turns you the back, it's one of the signals that there is a problem with your what? Your breath. So I encourage all the married to pay more attention to taking care of your tongue, and taking care of your mouth, because this is one of the components of success in your marriage. Because if you have I remember I was treating one of the patients. She had moved, I think she was from the northern region. She had moved in several places, and the in-laws were telling the wife that you have bad breath, you who has a smelly mouth. And they could even haunt the children that your mother has a smelly mouth. So this lady was so depressed and so on. But she moved to all the dentists. They sorted out all the problems in the mouth. They treated all the mouth, but they had not paid attention to the what? To the tongue. So when he came, I had to do the tongue and also do the masking of I prescribed some mouthwashes and so on, and referred her to some physician. And the marriage came back to what? Came back to life. And a bad breath is very unique. It is only people who love you that will tell you that you have bad breath. And of course, me, a dentist, I would definitely tell you, even if what I would tell you that the smell is not what? Okay. But even if, for you to know that this is my closest friend, they can give you money, they can stand with you. Even your husband cannot sometimes tell you, but will go and talk with his what? Friends, and he brings in another negative actions towards you, and so on. Maybe tries signaling certain things. So, to be all around man, to be all around woman, take care of your oral cavity, and that is the mouth.
Wow, thank you so much. Doctor, you've talked about something very important. Thank you so much. You've really helped us in detail about the tongue. I think that is some of the information that people are lacking. And I hope our viewers, you're getting a lot of knowledge from this interview. You've touched something that is right now one of the popular things in Uganda, that is mouthwash. And those mouthwashes are now being tied into praise they're giving people to make their mouth smell good. They are scented. I don't know how safe mouthwashes are and how those scented perfumes are.
Okay, thank you very much. I don't want to be a victim of under narrating anybody's anybody's business, but the reason why we always prescribe mouthwash is to, one, they help to lower the too much aggressiveness of microorganisms. But as dentists, we prescribe mouthwash that has got chlorhexidine content in it, because that will calm down and reduce the activeness of germs in the mouth. But in the market, I see so many people advertise mouthwashes that when you take it will stop tooth decay and so on. Yes, it might stop tooth pain, but the decay will still what? Progress. So I don't want to condemn any mouthwashes used in the market, but the ideal way for you to sort out your oral cavity is you brush. If you feel you are off, you cannot visit a dentist. But in personal, I prescribe mouthwashes after I've done my scaling and polishing, because it helps. And also, mouthwash can just be used as a home when you have finished brushing, to give that fresh breath after you have finished brushing, probably in the morning. You can do the mouthwash, but you need to be very keen with the contents or the ingredients in that mouthwash. Some of them have their alcohol content and so on. It might affect the normal flora. Normal flora is the different kinds of germs that are meant to be in the mouth, and they are ideal, they are meant to be there. So if you take mouthwashes anyhowly, maybe because of the way you have picked and enjoyed the adverts and so on, it might affect the normal flora. And when it affects the normal flora, then there will be some changes in the mouth. Some certain diseases may encroach in. So we also need to be very careful with that. But basically, for your oral health or your oral hygiene, let's observe toothbrushing, visiting a dentist, and that will help you.
Wow. So, doctor, one more thing is about teeth whitening. That topic is now, what I've seen about the community, just like mouthwashes, they like prescribing things for themselves. Because they hear mouthwash, so they think it's just a matter of water, which I'm going to just put in my mouth, then I spit. So I thank you because you've put that to light. Did you mean that they have to be prescribed by a dentist?
Yes, mouthwashes needs to be, they have to be prescribed by dentists, because professional dentists who understand more about them, because they will tell you which one is ideal. But if you just go and take them anyhowly, it might bring some effect here and there. But I would recommend, if you need to use a mouthwash, let your dentist recommend you on the ideal kind of mouthwash you're supposed to use. Your question about tooth whitening, it is a prominent one. Everyone wants white teeth. But God is very special. God is very unique, one, and that's why the Bible, for those who read the Bible, I think in the book of Genesis, when God finished creation and he said, let us now create man out of your own image and our own likeness, meaning the beauty, the handsomeness of what? Man. So are the teeth. So in most cases, teeth, the color of teeth depends on your skin color as well, because God does not bring color crash in one or the other. That's why you see me, I'm a dark man. I have white teeth, because I should also be recognized with my teeth. In case I'm in a dark place, I shouldn't disappear totally. But there are certain cases where we recommend tooth whitening. And that also depends on the dentist who has seen you. There are certain people who have like teeth stains or fluorosis, when the fluoride levels are so much. Mostly people who live along the lake shores, like those who grew up from Mombasa, maybe even in Uganda, some parts of Fort Portal, and also along the shores of Lake Victoria, you will have extrinsic stains that are caused by maybe high levels of fluoride, and these stains cannot easily go away. They are not like maybe tobacco stains. So in most cases, we recommend tooth or teeth whitening. It might be teeth or a particular tooth. But to whiten teeth, it is the doctors, the dentists who know what to do. But it is generally like a chemical-like treatment where we expose these teeth to certain chemicals. Then those chemicals will wash away any decay in the, any stain that is inside a part of the tooth, mostly in the enamel, or it goes maybe even some parts of the dentin. So it is the dentists who know how to do it. But there are certain people who wants, maybe he or she is a celeb, she wants her teeth to be looking so bright when she's in cameras. You also don't need just to do it, it needs the guidance of the dentist. But there are some repercussions, because when you do tooth whitening, in other words, another name, we call it bleaching. You bleach your teeth. Once you have started bleaching, you need to continue with it. It is an expensive thing, okay? So is tooth whitening, because you will affect the good makeup of teeth. You'll affect the enamel, you'll even affect part of the dentin, and the tooth becomes sometimes porous, and it can now easily become sensitive in one or the other. But I see in the market there are certain chemicals we use for tooth whitening that tend to have also another chemical that takes care of what? Sensitivity. But those are some of the repercussions. You'll have generalized sensitivity, and in the long run, maybe when you're of age, now I'm in ladder 4, when you're in ladder 5, you will definitely need to put in other measures which are quite expensive. So I would recommend, if it is just because of stains that affects your aesthetic means the beauty, the way you smile and so on, you can go for it. But if it is just because of someone has told you your teeth are dirty, or you have seen in the mirror and so on, I would request you to visit the dentist. Then they give the professional advice before you go for it. It is of course nice. You will look very sparkling, very attractive, but there are some repercussions in it. So before you go for tooth whitening, seek a professional advice from a dentist, and the guidance who will guide you, the do's and the don'ts, the side effects. Then you go for it when you have informed point of view. Thank you.
Oh, thank you so much, Doctor. I think you've heard that teeth whitening comes at an expense or at a cost, and you have to pay some repercussions at the end if you're not careful. So as we close up this interview, just one last thing that came to my mind, Doctor, that is tooth scaling. Do you think this is one of the treatments for bad odor?
Yes, scaling is one of the treatment for bad odor. It's a professional scaling. There are different types of scaling. There is a manual kind of scaling. You remove, because as in the earlier part of our discussion, I said one of the causes of this is bad oral hygiene, where you have caliculus, which people call carboli. It will always be there. So the microorganisms, the germs, will sit there in most cases, and that will affect the gum. So when the gum is affected, is bleeding, is swollen, the bad breath will come in from there, because food particles will always pack there. So what the dentist does, they do professional scaling. And the scaling, there is what we use, we do manual, but Ugandan dentistry has evolved. We now do, we scale using the machine. We call it a scaler. It is mounted on this dental chair, then you just clean. But it must be a qualified dentist, because in most cases, if someone is not qualified, they will cut your gum. So that is one of the, it is true, it is one of the treatment which is prescribed for bad breath. But it needs, when the bad breath has been assessed by a professional dentist, and when he has done that, then he will know which kind of treatment he or she will give.
Wow. Does the electric toothbrush, it is now popular? I'm just telling you some of the things that I've seen on the comments. When I made a video about people smelling when they come to the hospital when we're working on them, and people are like, please teach them how to bathe and teach them how. So that's the cause of this interview. So one of the things people are asking, the electric toothbrushes, do they help in that scaling?
The electric toothbrush, as it says, the toothbrush cannot scale. These germs, caliculus or carboli, cannot just go by you using electric toothbrush. Electric toothbrush is for, of course, high up, I can say, upscale clients or lifestyle. You can afford, it's not cheap, it is expensive, but it is one of the ways of brushing. And another unique thing about it, it is quick, and personally I've prescribed it for, one, the handicap kinds of patients. There are patients who cannot clean themselves. Maybe they have certain conditions and they cannot open their mouth easily. So when you use electric toothbrush, it will be quick, and the toothbrushing is done. So it cleans, yes, it cleans, it shortens the cleaning time, and it can go to all the angles of the mouth and clean the mouth very well. But however, that electric toothbrush has got programs. It has got programs. It gives you programs when you're cleaning maybe a sick gum, when you're cleaning the person who has the gingival recession, when you're someone maybe who is a smoker. So in most cases, we mess it up because we don't know how the program. So I encourage whoever is using electric toothbrush, know the programs, then you know which one is meant for you. Yes. Personally, I prescribe, but I've never used electric toothbrush, though I've seen it, I know how it works, but I prefer using the manual soft toothbrush because I get the details, I get so much detail when I'm doing it.
Thank you so much. That was a very great interview. Thank you so much, our viewers, for watching. But I want to give a round of applause to our doctor who has, made time to come and inform the nation and inform you and me. And I hope that you've picked a lot. Myself, I've picked a lot. I hope that you've picked a lot of information that is going to be helping you to stop, bad odor, or to help you with cleaning your teeth. Like the advantages he has given, your marriage will be saved, your friendships will be saved. If you're not married, you'll get yourself someone because your mouth or your aesthetic is good of your oral cavity. And so in just one word, I want him to summarize, and not really summarize, but I want him to just give us what is that thing on his heart that he has been thinking and saying, if I ever get a chance, I would tell this to the nation.
Yeah, I would just say, please, let us improve on our health-seeking habits, mostly visiting dental hospitals. We have regional referrals, have fully pledged dental facilities. We also have national referrals. Justice Mulago has a fully pledged facility. And these services, most of them are free and others are the subsidized cost. But if you can afford, have your professional dentists in any private setting. But my last punching shot is at least twice in a year, have a dental visit.
Thank you so much, Doctor. It was great having you. Thank you for sparing your time. May God bless you so much.
Amen. Thank you very much, and thank you for the great work you're doing. I greet you all. I wish you all the best. Visit a dentist, and you'll be fine. God bless.
God bless you so much. Thank you for watching. This is Beatrice Chimpi. Till next time, bye.